Hello everyone, I'm Kelly Barnett. Welcome to my channel Instant Healthcare, where I share simple tips, expert advice, and motivation to help you live a healthier, happier life. Let's take charge of our health one step at a time. Today, we're diving into a subject that's close to my heart: concussions in children. As parents, we want the best for our little ones, and that means being informed about their health and well-being. Concussions can be tricky because they often don't leave any visible marks, making them harder to spot. But don't worry, I'm here to break it down for you in a way that's easy to understand and even easier to remember. So grab your favorite snack, get comfy, and let's learn together. Before we jump in, don't forget to hit that like button, leave a comment down below, and subscribe to my channel for more helpful tips and tricks on parenting, health, and everything in between. Your support means the world to me. Now let's get back to those concussions, shall we? Did you know that concussions are often called the invisible injury? That's because, unlike a broken bone or a cut, you can't always see the signs of a concussion. It's like a secret code that our bodies use to tell us something's not quite right. But don't worry. Once you know the code, you'll be a pro at spotting those sneaky concussions. Okay, so what are some of those secret code words, you ask? When it comes to understanding concussions, it's crucial to recognize the physical symptoms that our bodies use to communicate with us. These symptoms act as warning signs, alerting us to potential issues that need immediate attention. Well, when it comes to concussions, our bodies like to give us clues in the form of physical symptoms. These clues can be subtle or quite pronounced, but they're always important to notice. By paying close attention to these signs, we can ensure that our children receive the care they need as quickly as possible. Think of it like this. If your child takes a tumble and experiences any of these symptoms, it could be a sign of a concussion. It's not just about the fall itself, but how their body reacts afterward. The symptoms can vary in intensity and duration, but they all serve as indicators that something might be wrong. Headache. This is one of the most common symptoms of a concussion. It can manifest in different ways, from a dull, persistent ache to a sharp, throbbing pain that seems to pulse with every heartbeat. This pain can be localized to one area or spread across the entire head. It can feel like a dull ache or a sharp, throbbing pain. Sometimes the headache might come and go, while other times it can be constant and debilitating, making it difficult for your child to focus or engage in their usual activities. Dizziness. Your child might feel unsteady on their feet or like the room is spinning. This sensation can be disorienting and frightening, especially for younger children who may not have the words to describe what they are feeling. They might appear clumsy or have trouble walking in a straight line. Nausea or vomiting. Feeling sick to their stomach or actually throwing up can also be a sign. This symptom can occur immediately after the injury or develop a few hours later. It's important to monitor your child closely and seek medical attention if they experience persistent nausea or vomiting, as it could indicate a more serious issue. Fatigue. Your child might feel unusually tired or lethargic. This can be a result of the brain working harder to heal itself, and it's important to allow them plenty of rest. Encourage them to take breaks and avoid strenuous activities until they feel better. Sensitivity to light or noise. Bright lights or loud sounds might become overwhelming for your child. They might prefer to stay in a dimly lit, quiet room to avoid discomfort. This sensitivity can make it difficult for them to participate in normal activities, such as attending school or playing with friends. Confusion or memory problems. Your child might have trouble remembering things or seem confused about what happened. They might ask the same questions repeatedly or have difficulty following simple instructions. This can be a sign that their brain is struggling to process information correctly. If you notice any of these symptoms in your child after a fall or bump to the head, it's important to seek medical attention right away. Early intervention can make a significant difference in their recovery and help prevent further complications. Remember, when it comes to concussions, it's always better to be safe than sorry. Section 5. Beyond the physical, emotional, and behavioral changes. Now, Here's where things get a little trickier. Concussions don't just affect our bodies. They can also mess with our emotions and behavior. It's like someone hit the shuffle button on your child's personality. They might seem more irritable or fussy than usual. Little things that wouldn't normally bother them might set them off. Sad or depressed. They might seem down in the dumps and have less interest in things they usually enjoy. Anxious or nervous. They might feel more worried or scared than usual. Section 6. Cognitive challenges. When thinking feels different. Understanding how concussions impact cognitive functions is crucial for parents and educators. Concussions can also make it harder for our brains to do their thing, like thinking, remembering things, and concentrating. When a child experiences a concussion, the brain's normal processes are disrupted. This disruption can lead to a variety of cognitive challenges that can affect their daily life. It's like trying to run a marathon with a sprained ankle. It's just not going to be as easy. Your child might find even simple tasks to be overwhelming. They may struggle with activities that were once second nature to them, have trouble concentrating or remembering things. They might have a hard time paying attention in school or remembering what they did that day. This can be particularly frustrating for both the child and their caregivers. Imagine trying to focus on a lesson or complete homework when your brain feels foggy and slow. Feel confused or disoriented. They might seem lost or unsure of where they are or what they're doing. This disorientation can be scary and disheartening. It's important to provide reassurance and support during these moments. Speak more slowly than usual. Their speech might sound slurred or like they're having trouble finding the right words. This can be a sign that their brain is working harder to process information. Patience and understanding are key. Encourage them to take their time and express themselves at their own pace. It's important to remember that these cognitive challenges are a normal part of the healing process. With time, rest, and the right support, most children will see improvements. However, it's crucial to monitor their progress and seek professional help if needed. Encouraging light activities that don't strain the brain can be beneficial. Activities like drawing, reading, or gentle play can help keep the mind engaged without overwhelming it. Social interactions, when the child feels up to it, can also provide a positive boost to their recovery. Recovery from a concussion is a gradual process. It's important to follow the healthcare professional's advice and give the brain the time it needs to heal. This might mean taking breaks from schoolwork, limiting screen time, and ensuring plenty of rest. As your child begins to recover, they can slowly return to their normal activities. Keep communication open with their teachers and caregivers to ensure they are supported throughout their recovery journey. With patience and care, your child can overcome these cognitive challenges and return to their usual self. Section 7. Sleep disturbances, resting but not recovered. Sleep is super important for our bodies to heal and recover, especially after a concussion. When we sleep, our brains and bodies go through critical processes that help repair and rejuvenate our cells. This is even more crucial for children who are recovering from a concussion, as their developing brains need ample rest to heal properly. But sometimes, concussions can make it hard to get a good night's rest. The brain's normal sleep-wake cycle can be disrupted, leading to various sleep disturbances. This can be incredibly frustrating for both the child and their parents, who are already dealing with the stress of the injury. It's like trying to sleep on a bumpy bus ride. You're technically resting, but you're not really getting the quality sleep you need. Your child might experience frequent awakenings, vivid dreams, or even nightmares. These interruptions can prevent them from reaching the deep, restorative stages of sleep that are essential for healing. Have trouble falling asleep or staying asleep. They might toss and turn all night or wake up frequently. This can lead to a cycle of anxiety and frustration, making it even harder for them to relax and fall asleep the next night. It's important to create a calm and soothing bedtime routine to help ease them into sleep. Sleep more or less than usual. They might be extra sleepy during the day or have trouble sleeping even when they're tired. Daytime sleepiness can affect their ability to concentrate in school and participate in daily activities. On the other hand, some children might find it difficult to nap or rest during the day, despite feeling exhausted. Monitoring their sleep patterns and consulting with healthcare professionals can provide strategies to improve their sleep quality and overall recovery. Section 8. The importance of early identification. Okay, so now that you know the secret code words for concussions, you're probably wondering, why is it so important to identify these symptoms early on? Well, think of it like this. The sooner you catch a fire, the easier it is to put out, right? The same goes for concussions. Early identification and treatment can make a huge difference in your child's recovery and help prevent any long-term problems down the road. Section 9. Seeking medical attention. When in doubt, check it out. If you think your child might have a concussion, it's always best to err on the side of caution and seek medical attention right away. Remember, you know your child best. If something seems off, don't hesitate to trust your gut and talk to a doctor. They can assess your child's symptoms, determine the severity of the concussion, and create a personalized treatment plan to help them get back on their feet. Section 10. A journey to recovery, patience and support. Recovering from a concussion takes time, and every child is different. Some kids bounce back quickly, while others might need a little more time and support. The most important thing is to be patient, understanding, and create a loving and supportive environment for your child to heal. Encourage them to rest, avoid activities that could put them at risk for another concussion, and follow their doctor's recommendations. Section 11. You've got this, parents. And there you have it, a crash course on concussions in children. Remember, knowledge is power, and now that you're armed with this information, you're well equipped to spot those sneaky concussions and help your little ones get the care they need. You're doing an amazing job, parents. Keep up the fantastic work, and I'll catch you in the next video.